Jamaica recorded 335 new cases of COVID-19 yesterday and 6 additional deaths, bringing the total number of confirmed cases to 36,231 and the death toll to 542. Health and Wellness Minister Dr. Christopher Tufton pointed out that younger persons are contracting the virus and infecting older family members who are at a higher risk of death.
Real tragic scenario. So we really have to ask ourselves, are we willing to sacrifice our parents, our grandparents, our aunts, our uncles, our senior family members for the opportunity to mingle?
The private sector organization of Jamaica, PSOJ, has welcomed the approach taken by the government to implement a partial lockdown around the upcoming holiday period and weekends to curb the spread of the COVID-19 virus. And some hoteliers in Negril, Westmoreland are praising the government as they are now in receipt of the tourism grant promised by the government last year to assist them with the economic fallout brought on by the COVID-19 pandemic.
After many months of the process of applications, providing all the documents, and so the grants were finally disbursed on Monday. So many of us received our grants on Monday and we're very happy to do so.
Good evening. Jamaica recorded 335 new cases of COVID-19 yesterday and 6 additional deaths, bringing the total number of confirmed cases to 36,231 and the death toll to 542. According to the Ministry of Health and Wellness, the latest fatalities are an 83-year-old woman from Westmoreland, a 64-year-old man from St. Catherine, a 68-year-old man from St. Elizabeth, a 77-year-old woman from St. Anne, a 68-year-old man from St. James, and a 92-year-old woman from St. Anne. 2 more deaths were reported under investigation. Meanwhile, the new cases consist of 197 females and 138 males, with ages ranging from 1-year-old to 103 years old. The cases were recorded in Kingston and St. Andrew with 79, St. Catherine 54, St. James 39, Clarendon 36, St. Mary 32, St. Anne 31, Westmoreland 24, St. Elizabeth 16, Hanover 10, St. Thomas 5, Manchester 4, Trelawney 3, and Portland 2. The country also recorded 181 recoveries, bringing the total number of recoveries to 16,490. During the Ministry of Health and Wellness COVID-19 conversations on the COVID-19 vaccination implementation plan, Dr. Christopher Tufton pointed out that younger persons are contracting the virus and infecting older family members.
We are in fact the cause substantially of the challenges that we're facing. And it's unfortunate. We complain when the restrictions are imposed, the most recent ones seeing a shutdown over the next 3 weekends as announced by the Honorable Prime Minister. But the reality is that these are own goals, these are self-inflicted wounds, and it is extremely costly. It is costing lives. A very important note is that we see our older population who are ending up, for the most part, in our hospitals, caused by them picking up the virus, and in more often than not cases, it's being transmitted via the younger population. The 20 to 29 age group are the ones who are most infected and the ones who are dying most are those that are over 60. Real tragic scenarios. So we really have to ask ourselves, are we willing to sacrifice our parents, our grandparents, our aunts, our uncles, our senior family members for the opportunity to mingle without the mask, not obeying the protocols? And I want to really make an appeal to all Jamaica and our young people that this is as important to you as it is to the rest of us.
Minister Tufton also commended the healthcare workers who have been risking their lives to deal with the virus.
The healthcare team continue to work very hard in the field, and I want to use the opportunity to recognize them. And they do so at considerable risk. There are some 180 nurses currently infected or otherwise under quarantine currently due to COVID-19, latest statistics that I have gotten. 180, suggesting that our frontline workers are challenged every day because they are the ones who have to work in our hospitals, in the health centers, in the streets, doing whether contact tracing, providing information. And this is why they were first in line for the vaccine. But nevertheless, it's so important to recognize the efforts that they put out every day. I do note sometimes we are critical of some of the programs that they have to implement on the ground. I think we have to also provide encouragement and support to them because in a sense they are our soldiers in the field and they are impacted every day. And they have families who are also affected by the challenges that they face.
Dr. Tufton also announced that the first Blitz site will open this Saturday at the National Stadium in Kingston with a target of 1,000 vaccination.
10 days into our vaccination efforts, we have vaccinated some 24,502 persons in Jamaica, in the country. And this, of course, with the AstraZeneca vaccine. The number represents some 52% of our target for the month, which is some 47,650. And of course, we're going after 1.9% of our population. Still early days. Our 1.9 million persons. Our first vaccination blitz is set for this Saturday, March 27th, 2021, at the National Arena. Other blitz sites will be operational in due course, and we will announce those. We're looking at the Montego Bay Convention Center in St. James and the Bahe Principe Hotel in St. Anne's. So we intend to begin rolling out these blitz centers, which is a phase, the third phase of the three-phase approach, with hopefully another phase to come involving the private sector. But this is the Blitz Center approach, where we pull together a much larger infrastructure of medical personnel, where our mobilization efforts are a lot more significant, and where we try to vaccinate or set a target to vaccinate some 1,000 Jamaicans.
Meanwhile, Chief Medical Officer, CMO in the Ministry of Health and Wellness, Dr. Jacqueline Bisesa McKenzie, explained how following the protocols help reduce the infection rate.
Our observational studies are showing that 0 to 50%, 51% of persons are wearing masks at any particular time in different parts of the island. Now, this needs to improve. When we do the reports, when persons report their mask wearing, we will notice that many more persons say they are wearing the mask, but they say they're wearing the mask, but they're not wearing the mask properly. That is what we're observing. Many people report that they're always wearing the mask, but still not properly, and therefore still we're having exposure. Next slide. In terms of gatherings, what we have also noticed in a study that was done by Jamaica, the Labor Force Survey, was that 1 in 4 persons are still attending public gatherings, example parties. So that means that if 23% of persons are still attending, that's a considerable number of persons that are still attending gatherings and having opportunity for spread. We had that 1 in 5 persons were attending private gatherings with 15 persons or so. Now, this is also going to result in considerable spread. 1 in 8 persons have been to bars, to nightclubs, and other places of amusement. Now, in December, in the months prior to the survey being done, hundreds of thousands of persons attended public gatherings and private parties. Now, these persons that attend these gatherings are often young persons who tend to have high contact with persons in their age group as well as persons in other age groups. Hence, the numbers that we are seeing with the 20 to 29 and the 30 to 39 having our largest numbers. But we again to remind persons that these persons are spreading to the vulnerable population, resulting in illness.
Dr. Bisesa McKenzie also explained the accuracy of private testing.
Positivity rate that we use is depending on the positives from the PCR testing and the antigen test that is done in the public sector. And this is because the negatives can be verified. What will happen is that we will have a large number of tests, antigen tests, that are being done in the private sector. And for that set of persons, because it is that there is a high level of false negatives, meaning that the tests are not being done as it should be done in terms of antigen tests have a higher pickup rate in symptomatic persons. What we have are tests being done for traveling in a lot of cases, and these are asymptomatic persons. So you may end up with a negative, but the person may be actually in a very early phase of infection and have low viral load and may actually be positive. But the negatives are not going forward for PCR confirmation. And so because we do not know the correct status of those negatives, we would not use them in the calculation of our positivity rate, because then it would skew the positivity rate to give a false impression that we are having very little infection when in fact we are having higher levels of infection.
Shadow Minister of Health and Wellness, Dr. Maurice Guy, says the new COVID-19 measures by the government offer no solutions to the medical management of the crises. Dr. Guy says the cabinet decisions announced by the Prime Minister to control the surge in COVID-19 cases focuses entirely on what he said is social control strategies. In a statement released today, the Shadow Minister of Health and Wellness said that the plan does not reflect input from scientists and health professionals who have the burden of day-to-day management of the crises, and that the measures do not offer a solution to improve the medical management of the COVID-19 crisis, despite the health sector being completely overwhelmed. Dr. Guy said he is now urging a whole-of-country approach to the crises, involving the opposition, the private sector, and civil society, pointing out that all public and private health professionals must be mobilized and deployed to save Jamaica. He is calling for vital hospital supplies, including oxygen, drugs, safety clothing, and disposables, to be deployed to all institutions within the public health system, and masks to be distributed free of cost to low-income and unemployed persons. In the meantime, the private sector organization of Jamaica, the PSOJ, has welcomed the approach taken by the government to implement a partial lockdown on 3 weekends and around the upcoming Easter holiday period to curb the spread of the COVID-19 virus. The PSOJ says while the measures will no doubt impact commerce for those businesses that thrive during this season, in light of the strain on the health system, the positivity rate, and loss of lives, it believes that this intervention was required considering the blatant breach of the protocols taking place. This sentiment was echoed by the MSME Alliance, a member association of the PSOJ. The PSOJ says moving towards a digital economy will play a critical role as Jamaica continues to balance lives and livelihoods as the country works toward herd immunity. As such, the PSOJ says it is pleased to be a part of the e-commerce National Delivery Solution ENDS as a digital option to ensure some economic activity during curfew hours, particularly for the micro and small business, which will be piloted in Portmore. In other news, some hoteliers in Negril, Westmoreland are praising the government as they are now in receipt of the tourism grant promised last year to assist them with the economic fallout brought on by the COVID-19 pandemic. President of the Negril Chamber of Commerce, Richard Wallace, says this is a well-needed grant.
After many months of the process of applications, providing all the documents, and so the grants were finally disbursed on Monday. So many of us received our grants on Monday, and we're very happy to do so. So there were different aspects to the care program or the care package that the government promised. There was the best cash, there was the set cash, and there was a grant. Now, the set cash was monies paid directly to the displaced workers. The best cash was paid to employers in the industry so that we could keep as many workers as possible on the job. So that has been ongoing, and it has been extended several times, and we are very appreciative of it. And we just want the government to know how grateful we are for the assistance that we received over the months, culminating in the tourism grant that was issued on Monday. We really appreciate it, and very often we criticize governments on issues. We're quick to criticize, and I just wanted to say that we are really grateful, and it has helped us a lot, and we just wanted to send that message out to the government.
Mr. Wallace also explained how persons become qualified for the grant.
The grant was based on what you qualify for. So you had to provide paperwork, you had to provide documentation. There was a process, and it was kind of intensive, but once you were able to provide and justify the grant, then you were issued based on what you qualified for. So different people, different entities receive different amounts. I hear that it was up to $5 million, but I know not everyone received that amount. We're happy that we received it, and some people say they would have wanted more, but considering the circumstances, considering the situation that we all are in, including the government of Jamaica, we are very grateful for what we received.
He further added that he is optimistic as the industry in the parish is showing an increase in bookings.
It has been a very devastating year for us in the industry, to say the least. Things have been really bad for us. A lot of business, struggled really badly during the year. So it's been a really bad year for us. We are very optimistic that we are seeing the light at the end of the tunnel. By all indications, the industry is getting ready to come back with a bang. The surge that was predicted after the pandemic is taking shape based on bookings, based on reports that are coming out of the industry. There are reports of bookings that are exceeding 2019, which was pre-COVID. So we're very optimistic, and we're looking forward to next year, to also as early as this summer. I believe we will start seeing an uptick based on the the bookings that we're getting now, we're seeing an uptick in bookings starting after May, during the summer, and especially in the upcoming winter season. So we're cautiously optimistic. We hope nothing will happen to change that, but by all indications, we are on our way to recovery.
And one visitor to Negril, Paula Maxwell, who is visiting from Texas in the United States, said that she feels very safe given the protocols put in place by the Jamaican government.
It's a very exact process. So in order for us to be able to travel to Jamaica, first we had to apply an application or make an application to be allowed to enter the country of Jamaica. But we also had to have a specific kind of COVID test, a PCR or an antigen test, within 3 days of traveling. So we did our test, we made the application to the country, we had to wait to hear back from Jamaica to make sure we were accepted, had our COVID test ready, and then once we had both those pieces in place, we had the reservations. And the airport equally, the airport would not allow us to board the plane, so we had all the paperwork ready, both at the gate, both when we checked in with our baggage and at the gate. And when we got to Jamaica, we also had to present all the same paperwork. It has been absolutely wonderful. I feel as safe here as I do at home. The same protocols that I have to practice. I'm from Texas, and the same protocols I have to practice with masks, temperature, sanitizing. It's the exact same here. So the temperature taking, so everything I'm used to doing anyway, I'm still doing here, which I like, because I do feel very safe. The open air restaurants, the people that we love and have always visited, everything is in place. And there's not a moment that I have felt like my safety was in question at all.
Meanwhile, vendors in the Negril Market and Arcade are calling on the local government to provide better facilities as they are currently in a bad condition.
The Negril community know me as nurse. Well, I'm very concerned about what is taking place. There is no market in place. And as you can see right now, we are in town. I just drive in, and what I see, I have to be a part of this. It is really distressing in a way that we can't see why Negril is looking like this over the last 50 years, as far as I'm concerned. Because what is happening here now is to show us that within Negril, there is not much in Negril. But Negril, the name of Negril is a very essential name, a very vital name that people from all walks of life want to be in Negril. But what is in Negril? Negril has not much more than hotels to offer. The infrastructure in Negril is very poor.
My name is Carol Davis. I'm in Negril over 40 years now doing marketing. We need a proper market because where we are now, when the rain fall, we wet up. You see? And okay, sometime come and break into we stall and take out the things them. So we need a market right now, as in right now. We are suffering in Negril. Long time they promise us market. We need it now. Well, I hope so. We hope we get it now. Because we were promised to get it, and we may be sure we'll get it. So we need it now more than ever.
Another vendor said that she is calling on the Minister of Local Government to fulfill his promise of a new market that was promised to them for some time now.
My name is Joanne. I'm calling on Mr. Desmond Mackenzie, what promised us to make a market for us and have our money. We work hard for our money. We walk on the street and walk and beg it to make our market, and he promised we to give with the park, beside the park there, and he did it, and different people is there. We have nowhere, the water coming down, we are wetting up. We are here over 5 months. We have to pay $4,000 per month for the people's place. Mr. Mackenzie, we call on you to make a market.
In the meantime, former president of the Negril Chamber of Commerce, Daniel Grizzle, in speaking with our news team, pointed out that the vendors and the increase in tourist visitors have outgrown the market space, and mentioned that a spot has been located for the new market and arcade to be built.
We underestimate how fast Negril would grow. We have outgrown that. Not only that, what we had was a secondary thing, not a tertiary. We need a tertiary one. The lands have been identified for it, which is just outside of Sheffield, because you're not just talking about Negril and the Strip. You're talking about all the hills, the surrounding. Negril has grown. Nobody could imagine how fast Negril would reach where, and it's continued to grow. And another market which the government is not even conscious of, a lot of the guests that were coming here, they've been coming here. We have guests been coming from 75 when we had our first little place on the West End. They're still coming. Now those people are retired. They want to live here. Their net spending goes to Jamaica because they use our service, they buy our food. Some of them are more Jamaican than us. Right? No, but that market is growing. People are coming now and feeling let down, feeling disappointed. And therefore, we are not generating the kind of repeat that we used to.
In other news, the Denham Town Police are seeking the public's assistance to locate the relatives of an elderly woman who was found wandering yesterday. She gave her name to the police as Ruby Hall and stated that she is from the parish of St. Anne. Anyone with information is asked to call the Denham Town Police at 876-922-6441 or the police 119 emergency number. 24-year-old Siobhan Dawkins of Lampard Avenue, Frankfield District in Clarendon has been missing since March 18. He's of dark complexion, slim built, and about 5 feet 6 inches tall. Reports from the Maypen police are that at about 4:45 p.m., Dawkins was seen at home wearing a black and white hoodie, black and white shorts, and a pair of black slippers. All efforts to locate him have proven futile. Anyone knowing the whereabouts of Siobhan Dawkins is being asked to contact the Maypen police at 876-986-2208, police 119 emergency number, or the nearest police station. The Westmoreland police have listed 5 men as wanted for several crimes committed in the parish. They are 31-year-old Mashorn Samuels, otherwise called Sabo or Ami, of Hatfield, Westmoreland; Mark Wright, otherwise called High Grade, of Top Road, Little London, Westmoreland; 25-year-old Tariq McDowey, otherwise called the Blacks, of Geneva District, Grange Hill, Westmoreland; 29-year-old Andre Hines, otherwise called Bunny, of Sigri Street, Savannah-Lamar, Westmoreland; and 52-year-old Burton Shearer, otherwise called Bap, of Church Lincoln, Grange Hill, Westmoreland. Samuels is wanted for the murder of Ladwayne Russell in Hatfield District, Westmoreland on Monday, February 26, 2018. Wright is wanted for the murder of Carlisle Cook, which took place on Top Road, Little London, Westmoreland on Saturday, November 9, 2013. McDowell is wanted for wounding with intent and illegal possession of a firearm following an incident in Geneva District, Grange Hill, in the parish on Monday, March 23, 2020. Hines is wanted for the murders of Roger Reed and Antonica Weatherburn, as well as wounding with intent at Hudson Street, Savannah-Lamar, in the parish on Wednesday, September 30. And Shearer is wanted for the murder of Fabian Cooper at Church Lincoln, Grange Hill, in the parish on Thursday, May 12, 2016. The lawmen are urging these men to turn themselves into the Savannah-Lamar police immediately. Anyone knowing their whereabouts is asked to call the Savannah-Lamar police at 876-955-2758, police 119 emergency number, or the nearest police station. Citizens are also reminded that it is an offense to harbor a fugitive. And those are some of the stories making news. We will return with other stories with detectives in Manchester investigating the murder of an elderly woman in the parish. But first, let's take a break and then join Christopher Scott with sports.